Thank you for viewing our flash talk today, Understanding the History of the Opioid Epidemic and Drug-Related Stigma. In this short video, we will provide a brief overview on the history of the opioid epidemic and the role the pharmaceutical industry played in the start of this epidemic. We will also review the role drug-related stigma plays in treating individuals with substance use dependency. Over the past 25 years, the United States has experienced an unprecedented increase in opioid use disorder, opioid overdose, and opioid-related harms. Opioids became the pain treatment of choice and somewhat of a perfect storm. The opioid epidemic has come in waves. The first wave came when Oxycontin came to market, just as misleading research on the power of opioids was released. Additionally, an international push to better treat pain reduced drug costs and added pain in the U.S. healthcare system as the fifth vital sign. The second wave started when many prescribers cut off individuals with new opioid dependency when new research came out about the addictive properties of opioids. The sudden discontinuation of opioids resulted in many individuals turning to heroin to cope with their withdrawal symptoms and chronic pain. Now we are in the third wave of the opioid epidemic with the proliferation of fentanyl in the illicit drug stream, with an anticipated fourth wave on the horizon. These ways have shown that we need to change in how we address the use of opioids and the drug-related stigma associated with substance use disorders. Stigma is a social process which can reinforce relations of power and control. This leads to status loss and discrimination for the stigmatized. Substance use disorder is among the most stigmatized conditions in the US and around the world. Often people do not want to work with, be related to, or even see people with a substance use disorder in public. It has been shown that healthcare providers often treat patients with substance use disorders differently when it comes to healthcare. Those with a substance use disorder are often viewed as drug seeking patients. Clinicians have lower expectations for health outcomes for patients with substance use disorders. This in turn can affect whether the provider believes the patient is deserving of treatment. Some healthcare providers falsely believe that substance use disorders are within a person's control and cite feelings of frustration and resentment when treating patients with substance use disorders. The stigma experienced or expected to be experienced by people with substance use disorder have poorer outcomes than those who do not. People who experience stigma are less likely to seek out treatment services and access those services. When they do, people who experience stigma are more likely to drop out of care earlier. Both factors compound and lead to worse outcomes overall. So, how can you help? Overcoming the opioid epidemic is going to take all of us working together to become educated on opioid use and dependency and working to dismantle stigma to treat individuals holistically and with compassion. By partnering with us to learn more about stigma, opioid tapering, and alternate ways of managing patient non-cancer pain, we can turn the tide on opioid dependency in our community and reduce overdose. Want to know more? Please fill out the survey link provided with this video and someone will follow up with you. You can also contact the Southern Nevada Health District via email at pulver@snhd.org or by phone at 702-672-0042. Please feel free to visit us at our website at www.snhd.info/phd. References and resources.